World Health Organization head Dr Tedros Ghebreyesus is visiting several health and vaccine production facilities in the Western Cape today. These include the mRNA vaccine technology transfer hub and others that are helping in the response to COVID-19 and the protection of the public health system in South Africa. Dr Ghebreyesus and his delegation are being hosted by Health Minister Dr Phaahla and Higher Education Deputy Minister Buti Manamela. Well, for more on this story, we cross now to my colleague Bulelani Phillip, who's standing by. Thanks very much for joining us, Bulelani. Tell us more.
Well, good afternoon to you, Nompu, and to the viewers at home. And we're coming to you live from the Stellenbosch University, but at the Tygerberg Medical Center. But as you can see, we're standing in one of the labs that does genomic sequencing of COVID-19. And of course, they play a critical role in terms of determining whether there are upcoming variants and how is the landscape looking like. And joining me now in this conversation as they are welcoming the World Health Organization Director General is Dr. Monica Moy, who's going to explain to us firstly, what do you guys do exactly? I see a lot of equipment. What's happening behind us?
Hi, thank you for today. So we do the genomic sequencing of SARS-CoV-2. What that means is we will take a swab from a patient and we will break open the cell to get virus extracts from it. So we will extract virus RNA and we will amplify that to sequence it, so to get the RNA sequence. And with that we can get information of genetic diversity, we can diagnose different variants or variants of concern, and we can diagnose then how the virus is evolving genetically through time.
And through your research, what can you tell us about what we can expect in the near future about the evolution of the virus?
That's always a very difficult answer, because we never know how things are going to pan out. At the moment, it's too soon to say. So Omicron has dominated and is the dominant variant. And Omicron is split into 3 different lineages, BA.1, BA.2, and BA.3. So currently we are seeing that BA.1 was the dominant variant, but now BA.2 is very much on the rise and increasing. But at this stage, we are not yet concerned. It's no alarm for concern because cases are still relatively low in South Africa. And it's not usually worrying when a variant is increasing in dominance when cases are decreasing.
Now, a question for a layperson would be that could we expect more variants coming up in the near future?
I think the answer is most likely yes in the near future. Well, not necessarily near future, but yes. The virus will always be evolving and it's very difficult to contain. And when you cannot contain the virus, it has opportunity to evolve. And we are likely to see a new variant, maybe not necessarily coming from South Africa. But we are seeing a few cases where we have immune-suppressed patients, such as severely immune-suppressed HIV-positive patients. And if they are not getting adequate HIV treatment, their immune system is really, really low and not able to clear SARS-CoV-2 infection. And what that means is the virus is given a lot of time to evolve and to mutate within these immunosuppressed patients. So we really need to get those cases help and treatment in order for them to clear the SARS-CoV-2 infection so that it prevents any further evolution within those immune-suppressed cases.
Lastly, before I let you go inside, they'll be talking about South Africa being in the trial of being a vaccine manufacturing hub for the rest of the continent. Are you seeing a relation of reduced infections as a result of people taking up the vaccine?
Yes, definitely, most definitely. There is also a global trend where we are seeing increased vaccine uptake really does decrease cases, but mostly it decreases the severity of cases. So it will prevent hospitalization if you are fully vaccinated. There is a direct correlation that we are seeing.
Thank you so much, Dr. Monica Moy from the Stellenbosch University at the Tygerberg Medical Campus. On that note, Nombu, we'll cross back to you in studio.
Thank you very much for that educational interview. My colleague there, Bulelani Phillip.